Welcome to our presentation. My name is Alan Friedman. I'm with the AT Network. With us today is Malisa Rogan, and she's here from CMS to talk about changes to how Medicare is acquiring, how they're getting assistive technology through a competitive bidding program that's different in how they've done it in the past, and she'll talk to us a bit about what that means to us as service providers and what it means to our consumers. Last year we did a webinar similar to this with an industry person that gave us some of the consumer and industry concerns about this change. So now we'll hear from CMS about it. And with that, I'll turn it over to Malisa to do the presentation.
Thanks, Alan. Can everybody hear me okay? All right, awesome. Okay. As Alan said, my name is Malisa Rogan. I am the Competitive Bidding Implementation Contractor. We use CBIC for short. And I'm just going to talk to you a little bit today about the program. I know that you guys do service beneficiaries, which is what, you guys call them consumers. We call them beneficiaries. So I want to just let you guys know what's going on as far as the program, and then if you have any questions, I'd be happy to answer them. Again, this training or presentation is actually just to help explain what people with Medicare should know if they need Medicare-covered equipment and supplies that are included in this program. So just by way of history, the Medicare Prescription Drug Improvement and Modernization Act of 2003 mandated the development and implementation of the program. The law required phasing as a part of it. So then MIPA, the Medicare Improvements for Patients and Providers Act of 2008, came through and made limited changes. So the history of the competitive bid, the program builds on successful demonstrations. The Medicare Prescription Drug Improvement and Modernization Act of 2003, which is MMA, and it mandated the development and implementation of the competitive bidding program. The Medicare Improvements for Patients and Providers Acts of 2008, better known as MIPA, that came through and made limited changes. Then the Affordable Care Act further expanded the program. So how the program works, DMEPOS suppliers submit the bids. Now this is a process that the CBIC, who handles all the bidding and that kind of thing when the program began, suppliers who elected to participate in the program submitted their bids. So in order to be a contract supplier, they must submit the bid. Medicare uses those bids to determine the payment amounts, and then contracts will be awarded to those who won a bid to sell or rent DMEPOS items. Contract suppliers will be those who offer the most competitive price, that they have to meet eligibility, quality, and financial standards, and they have to be accredited by an independent organization. In addition to saving money for the Medicare program, the program helps save money for the beneficiaries, because when Medicare pays less, the beneficiary's 20% coinsurance payment is also less. For round two, this is a competitive bidding program expanded. It included 91 metropolitan statistic areas, or MSAs, and they also ran a national mail order program simultaneously. They were two separate competitions that were participated in, however, they were ran at the same time. So round two is actually scheduled to go into effect on July 1st. On your screen are the product categories that were included in round two. There's oxygen and oxygen equipment and supplies, enteral, nutrients, equipment and supplies, continuous positive airway pressure, CPAP devices, as well as respiratory assist devices, the RADs, and related supplies and accessories, hospital beds and related accessories, walkers and related accessories, support services, which include Group 2 mattresses and overlays, standard power and manual wheelchairs, scooters, and related accessories. Negative pressure wound therapy pumps and related supplies and accessories are also included in that. As I mentioned before, the National Mail Order Program for Diabetic Testing Supplies was also a separate competition ran in conjunction with Round 2. This is targeted to go into effect at the same time as the Round 2, which, if you remember, was July 1st. The National Mail Order Program includes the entire 50 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, Guam, and American Samoa. And the program is designed to ensure that the beneficiaries continue to get the quality supplies that they need while saving the money. So now the important part is who's going to be affected. Beneficiaries who have original Medicare and reside in a zip code that is in a specific CBA, which is competitive bidding area, they will have to obtain competitive bidding items as well when they visit that competitive bid area. To find out if that zip code is in a competitive bidding area, they need to call 1-800-MEDICARE. They can also use our website, which I'll provide at the end. And they can also have their caregiver or, for example, you guys who are referral agents, call to find out that information as well. Medicare Advantage enrollees can use suppliers that are designated by their plan. As we talked about the Round 2 product categories, these are the areas in California, the Round 2 MSAs, which includes Bakersfield, Delano, California, Fresno, Los Angeles, Long Beach, Santa Ana, Oxnard, Thousand Oaks, Ventura, Sacramento, Arden, Arcade, Roseville, San Diego, Carlsbad, San Marcos, San Francisco, Oakland, Fremont, San Jose, Sunnyvale, Santa Clara, Stockton, Visalia, and Porterville, California. These are all competitive bidding areas. Ellen, you had a question, round 1 cities in California?
Yeah, I know there were at least 2 places in California that were in Round 1.
Right, yes, Round 1. Did you, the Round 1s were Riverside, San Bernardino, and Ontario, correct? Is that what you're asking?
Yeah, thanks.
No problem. So using contract supplier, almost always the beneficiary is going to use a contract supplier if the items and services are included in the competitive bidding program where a beneficiary lives in a CBA. This also includes those beneficiaries that are traveling to or visiting a CBA. Doctors, treating practitioners, hospitals, and certain other items, walkers or folding manual wheelchairs. I apologize, bear with me just a second, I'm sorry. In hospitals, they can supply certain items. Doctors, treating practitioners, and hospitals can supply certain items like walkers, folding manual wheelchairs, and nursing facilities can only supply directly if they become a contract supplier. Now, a way to identify contract suppliers, you can visit the DMEPOS Supplier Locator Tool, which is at medicare.gov/supplier. They can also call 1-800-MEDICARE. They can also visit our website, which again I will provide, by entering their zip code, and it will allow them the opportunity to search by zip code to find providers that will assist them. Now beneficiaries also have the option to stay with the current supplier. They can stay with the supplier even if they did not win a contract if all of the following. The supplier, again, that did not win a contract elects to be grandfathered. The beneficiary permanently resides in a CBA. They rent certain equipment or oxygen when program starts in that particular CBA. If a current non-contract supplier elects not to be grandfathered, then that beneficiary must switch to a contract supplier. So what is a grandfathered supplier? A supplier issues prior written notice confirming the desire to continue the services. It works with the contract supplier to get new equipment for the beneficiary. And the beneficiary may continue getting services until the rental period ends, or they must switch to a contract supplier. If there's other insurance involved, Medicare may make payment to a non-contract supplier if required by that specific policy. However, the non-contract supplier must be accredited, must have a valid Medicare billing number, and must be eligible to receive secondary payments. For a non-contract supplier, if in a CBA, a non-contract supplier may not furnish the bid items. If the non-contract supplier is used, supplier must issue an advanced beneficiary notice or an ABN, informing that beneficiary that Medicare will not pay, but allowing them to understand that by signing that the beneficiary agrees to pay the entire amount. If no ABN is signed, beneficiaries are not responsible for that payment. Now for traveling beneficiaries, if the traveling beneficiary is coming to a CBA, they must use a contract supplier. If non-contract suppliers are used, suppliers must issue that ABN. If no ABN is signed, again, the beneficiary is not responsible for that payment. Now if a traveling beneficiary travels to a non-CBA, they can use any Medicare enrolled supplier, and that's no problem. So this is one of those scenarios because it can get a little tricky regarding the traveling beneficiaries. So, for example, Mildred's permanent residence is in Alaska, which is not a competitive bidding area, but she travels to Miami, Florida. While she's in Miami, she needs supplies for her continuous positive airway pressure CPAP device. Since Miami is in a competitive bidding area, Mildred must buy the supplies from a contract supplier. And if Mildred wants to obtain the supplies from a non-contract supplier, the supplier must have her sign an ABN. The ABN says Medicare probably won't pay for the supplies. By signing this notice, Mildred agrees to pay for the supplies. Now, if Mildred travels to Montana, which is not a competitive bid area, she may purchase her CPAP supplies from any Medicare enrolled supplier of durable medical equipment, prosthetics, orthotics, and supplies. So for specific brands, the doctor must prescribe in writing for a specific brand. Medical record must reflect the need, and the contract supplier must furnish the specific brand or form as prescribed, or work with doctor or treating practitioner to find suitable alternative, or help locate another contract supplier that can furnish the specific brand or form as prescribed. Now for equipment repair and replacement, for owned medical equipment, any Medicare enrolled supplier can make those necessary repairs. For replacement, however, you must use a contract supplier. For warranty repairs, you need to still follow the warranty rules. And for rented equipment, repairs are included in the rental payment, and the supplier must fix it at no charge to the beneficiary. Now talking about the deductible and coinsurance. So after beneficiaries pay their annual Part B deductible, Medicare is going to pay 80% of the Medicare approved amount for equipment, supplies, and services. Beneficiaries are still responsible for their 20% coinsurance. Contract suppliers cannot bill for more than these amounts. For suspected overpayment or fraud, it needs to be reported, so you would call 1-800-MEDICARE, which is 800-633-4227, or the TTY users can call 1-877-486-2048, and there's also a fraud hotline of the HHS Office of Inspector General, and that number is 800-447-8477. So some important points to remember is the program does not affect which physicians or hospitals the beneficiaries can use. They may need to change DMEPOS supplier, they may need to change to a DMEPOS supplier for Medicare to pay it. They may be able to stay with their current supplier if renting from a supplier who elects to be grandfathered. If in a Medicare Advantage plan, beneficiaries should check with their specific plan. So what are the things that the beneficiaries are going to need to do? Beneficiaries who live in or will visit a CBA and need medical items included in the program should find out if the zip code where they live or visit is included in a CBA. They need to find out if the items they need are included in the competitive bidding program in that area. They also need to find out which suppliers are contract suppliers for their items for the Medicare competitive bidding program. They can visit Medicare.gov or call 1-800-MEDICARE to find out this information. For questions, the websites on the screens are www.medicare.gov/supplier. This is for the DMEPOS supplier locator tool. You can also visit www.medicare.gov for consumer information. You can call again the 800-MEDICARE, or the TTY user should call 877-486-2048. The beneficiary's physician or supplier, or you can also contact Medicare's local information resources, the SHIPs, ACL, etc. Now, that's the presentation as far as any of the upcoming changes and how it's going to affect the beneficiary. So at this time, I'd be happy to take any questions that you may have regarding the program.
Let me start off by asking one. What happens when a consumer has been getting items from, more than one item from a supplier, and excuse me, the contract supplier only provides one of those items? Does that mean they have to go to 2 or 3 different vendors to get their devices because different contractors got different devices for that area?
Oh, sorry. Yes, the competitive bidding items are going to need to be received from a contract supplier. So unfortunately, if one supplier was not given or did not win the bid for oxygen and your consumer does need that, they will need to get that from a contract supplier.
And if they were also getting another item, say diabetic supplies from the same supplier, and that then goes to another contractor, so they have to deal with two vendors.
Yes, you're correct.
Are there any other questions?
Actually, I see that Bruce has a question. I'm reading it right now to respond to him.
Yep, Bruce's question is, do these competitive bidding requirements include custom wheelchair seating, position equipment, and augmentative communication, speech generating devices, and accessories?
Okay, so the speech generating devices, no, those are not a competitively bid item. Regarding the wheelchair, in the product categories for the wheelchairs, some of the items may be included in the competitive bidding program. For example, if it's a special seat cushion or positioning equipment, those kind of things, yes, those could be included. Once I'm looking through here to find if there's any more clarification regarding the wheelchairs things for you, Bruce. It's for standard power wheelchairs and scooters and related accessories. So I am assuming that when you're talking about custom wheelchairs, you're talking about a wheelchair that is specifically made for a specific person. Am I understanding you correctly? You're welcome. Is there any other questions for me? Katie, I see that you said that you have no experience with the competitive bidding program. Do you have further questions regarding the actual program? Okay, you said that you missed the first few minutes. That's fine. This still isn't coming to rural North State. Okay, it only affects the ones that I mentioned, and I see that you probably missed that. So give me just a minute and let me still find that fraud hotline real quick, and then I will get you the actual areas that it's covering. But for overpayment or fraud, the fraud hotline specifically is 800-447-8477 is the specific number for the fraud. Alan has my contact information that I'm sure he's probably going to do here in a few or whatever. And then I'd be more than happy to take any further questions that you guys have. I know I ran through them fairly quickly. If nothing is coming to you right now to ask me, I'd be more than happy to assist any way that I can.
I have a question.
Go ahead, Jeff.
Okay. If someone resides in a zip code adjacent to a CBA, and there's no vendors in there, and they do all their shopping supplies in the CBA area, are they able to purchase from anybody or from contracted suppliers only?
Okay, so you're saying that a consumer doesn't live in a CBA, but they go to a CBA
Correct.
to get their items? Yeah, they'll need to use a contract supplier if they're in a CBA.
That's called visiting, huh, in this case?
Basically, yes. Now, there is...
You mentioned the Sacramento and Roseville area here in Northern California. Mm-hmm. There's plenty of people who live just adjacent to those major commercial areas, and that's where they would get their supplies, and so they're still subject to being with contracted suppliers only, even though they reside in a different zip code.
Yeah, if they are going to a CBA to get the items, then yes, they need to get them from a CBA, or I'm sorry, a contracted supplier.
Got it. Okay, thanks.
You're welcome.
I just had one quick question, if we could have a show of hands of how many of you have consumers that are in a competitive bidding area in either the round 1 or round 2 that's coming up. it looks like most of the people are not in one of the CBAs.
Okay. Bruce, since this does seem to have you and your consumers in a CBA, if you would like more information, Alan is going to put or send out my contact information, and I'd be more than happy to chat with you again to set something up if needed for you at your organization or at your location. Sorry.
Okay, thanks. Since the consumers we work with we're working primarily with equipment that won't be required to be from a contractor provider. It may not be so important, but we'll let you know if we know folks who need some more info on it.
Okay, great. Alicia, you have a question?
Yes, I do. Can you hear me?
Yes, ma'am, I can.
I'm in San Francisco, so I don't know if I should have, click the one or not. I don't know if I'm in a bidding area. I'm going to see the whole PowerPoint and everything. Because I have many questions, but I don't know exactly what you said. Sorry about that.
No, it's no problem. Don't apologize. No worries. Technology is great, but when it doesn't work, it's not so great. I understand. Actually, San Francisco is in a competitive bidding area. It is in a CBA, to answer your question.
Great. Then I will need more information then. And another question I have, and I apologize if it has been answered, is some of my clients call because their power tools are broken, and does Medicare, is part of the bidding that the providers should give a loaner to the people? Like at least 3 people have been stuck in their houses like 2 months and with no chairs.
You have consumers that have been stuck without their equipment?
Yes.
Yes, that's a problem, obviously, but that should not be happening. Is it an issue with the supplier furnishing the item? Is that what the problem is?
The wheelchair vendors, there are some chairs that are having big issues and they keep breaking down, and the vendors, first of all, we have a crisis with vendors. So we have very limited access to people who actually work with Medicare, Medi-Cal, and they repair the chair once. One of the issues I'm finding is like the people get tires with air, and then they get a flat tire and they are stuck. So they just roll till they arrive home, and by the time they arrive there, the motor is burned, and then the vendor will replace it once, and when that happens again, then they are not responsible anymore. And when they repair the chair, they just come, get it, and the people are stuck in their houses with no equipment. We have a big crisis with the power chairs.
Okay, that is something that CMS particularly needs to be aware of, because for owned medical equipment, like if the consumer does own the medical equipment, any Medicare supplier can make the necessary repairs. However, if they need to replace something, once the program goes into effect, it'll need to be replaced with a contract supplier. However, if it's a warranty issue, the manufacturer needs to be doing it. So if what I'm understanding is correct, these vendors or these suppliers that are not doing that, that's a really big problem, and I actually need to know who they are because it needs to be investigated. No beneficiary should be stuck in their house not being able to get out because somebody doesn't want to repair their equipment.
I'll be happy to go through my list, and I'll be in touch with you, because actually there's especially one person who was ready to, okay, where can I start a lawsuit here, because it's not right.
Absolutely, yeah. And this program it deals, it doesn't deal with that directly. However, that's not okay. My parents are going to be on Medicare soon, and I would be that person. Like, somebody better give me some kind of information, because that's not acceptable at all, yes, please do get with me so I can look into that for you, please.
Thanks.
You're welcome.
I want to thank everybody for coming, and thank you, Melissa, for giving us this information.
Thank you for having me.